Yo, Med Decode. Welcome to Med Decode. We have a deep dive today that, is less about some esoteric finding and more of a really critical, urgent health alert, especially if you're in the U.S. and planning to become pregnant, or maybe you're expecting right now. We are looking at the alarming, and I mean truly skyrocketing, rise of gestational diabetes. And this isn't just based on a few reports here and there. We're unpacking a massive 2024 study. It analyzed an absolutely huge data set, over 12 million first-time births in the U.S. Between 2016 and 2024.
That is an incredible amount of data.
It really is. And that volume tells a story we just can't ignore. Okay, so let's unpack this. Our mission today is to understand two things. Why are gestational diabetes or GD rates accelerating so fast? And, crucially, why are specific groups shouldering such a heavy burden? We're talking specifically about Asian American, American Indian, and Native Hawaiian communities.
It's a profound issue, and to start, we should probably just, get really clear on the definition.
Yeah, good idea.
So, gestational diabetes is, put simply, glucose intolerance that's first diagnosed during pregnancy. And it's serious enough that it requires medical treatment to manage blood sugar.
Right, it's not just a minor fluctuation.
Exactly. But the stakes are really high, and they go way beyond just the 9 months of pregnancy. I mean, yes, GD complicates delivery and the baby's health in the short term, but the research clearly links it to long-term chronic health risks for both the mother, often increasing her risk for type 2 diabetes later in life, and for the child, who can face higher risks for obesity and other metabolic problems down the road.
So understanding this spike is, well, it's essential for public health.
Absolutely essential.
Okay, so let's get into it. When you look at the raw data from this 8-year period, it really is a nationwide wake-up call. We're seeing the sustained climb that suggests something fundamental is, shifting in the country's metabolic health.
Right.
So let's talk numbers. Let's go back to 2016, which is where the study starts. The rate of gestational diabetes was 58.2 cases per 1,000 live births.
So that's just under 6% of first-time mothers being diagnosed.
Exactly. Now, fast forward just 8 years to 2024, that rate didn't just nudge up a little.
No, it jumped.
It jumped significantly. By the end of the study, the rate hit 79.3 cases per 1,000 live births.
So we're talking nearly 8% prevalence now.
That is a colossal difference. I mean, if you do the quick math on that, that's nearly a 1/3 increase in cases in less than a decade.
Wow.
You just don't see a major health metric climb that steeply that fast.
You really don't. And when researchers analyze that, they look at something called the average annual percentage change, or AAPC.
Okay, so that's like the sustained growth rate.
Exactly. It tells us how fast the trend is accelerating every year, not just the simple difference between the start and end points.
Got it.
And for the U.S. overall, that represents a sustained average annual increase of 3.8% per year, every single year between 2016 and 2024.
So to put that 3.8% in context.
Well, just imagine any chronic disease growing steadily by nearly 4% every single year for 8 years.
That would be a crisis.
It signals a deepening systemic crisis. And what's really crucial here is that this upward trend was seen across nearly all the racial and ethnic groups they studied. This is widespread.
Okay, and this is where it gets really interesting for me. Because if the overall rate is climbing for everyone, you might just assume everyone's in the same boat. But this study makes it painfully clear that some communities are carrying just an unequal and staggering burden.
They are. And this is where we have to connect the data to the bigger picture of health equity.
Right.
We have to look past that national average and see who consistently had the highest rates throughout this entire study period.
So who was at the top of the list?
The study pointed to 3 primary groups that consistently led the nation in GD prevalence. Number 1, American Indian or Alaska Native individuals. Number 2, Asian individuals as a broad category.
Okay.
And number 3, Native Hawaiian or other Pacific Islander individuals. These groups weren't just seeing an increase, they were starting from a high baseline and climbing fast from there.
Wow. So that tells us we're really dealing with 2 problems at once, right? A baseline disparity that was already there, plus this new acceleration that's hitting everyone.
That's a perfect way to put it.
So let's zoom in on the Asian category for a minute, because that single term covers such an immense amount of diversity.
It really does.
And yet the overall prevalence of GD among non-Hispanic Asian individuals still saw an annual increase of 4.1%.
Which is outpacing the national average of 3.8%.
Exactly. And the study, it notes that even within these high-risk groups, there's a lot of heterogeneity. For example, within that larger Asian category, researchers found the highest absolute rates were among Asian Indian individuals.
Right, which just shows us that while the Asian category is a useful flag for high risk, we really need to dig into the specific sub-ethnicities to understand what's going on.
And that's exactly what the study did, and this is where I found the details to be, well, frankly, pretty concerning.
It's about the rate of acceleration, isn't it? It's one thing to have a high baseline, but it's another thing to see how fast that number is climbing in specific communities.
Let's pause on this because this is the data that's most actionable for you, the listener.
Yeah.
The rate increase wasn't just significant for Asian individuals as a whole.
No, it was across the board.
It was significant across all the specific Asian ethnicities they studied. This suggests that whatever is driving this, it's broadly affecting all these diverse communities.
Mm-hmm.
And the speed of this acceleration, the AAPC number, it's wildly different. We have to hear these numbers. For Chinese individuals, the AAPC was the highest listed, a staggering 6.8% annually.
Stop and think about that for a second. That rate of increase is nearly double the national average.
Double.
It suggests a community that is just rapidly facing and accumulating risk.
It really does. And the list of high rates continues. For Japanese individuals, an AAPC of 4.8%.
Still very high.
Filipino individuals were at 4.1%, Vietnamese 4.0%.
Yeah.
And then, rounding out the list with slightly lower but still very significant increases, Korean individuals at 2.7%.
Right.
And Asian Indian individuals, who we said started with that really high baseline, they still saw an increase of 2.6% a year.
And this raises such a critical question for researchers, Why are we seeing this uniform upward trend across such culturally and geographically distinct backgrounds?
Yeah.
Chinese, Korean, Filipino, Indian. These are not homogeneous groups at all, yet they are all experiencing a significant upward shift in GD rates over the exact same 8 years in the United States.
So wait, if these environmental or systemic issues are hitting Chinese, Indian, and Filipino populations, who all have distinct cultures, diets, different socioeconomic situations, what common American factor could possibly be the link here?
That is the essential question this data forces us to ask. It strongly suggests there are broad systemic factors, maybe common shifts in environmental exposures or risk factors here in the U.S. that are just disproportionately impacting these populations.
So it's a reaction to the American environment.
It could be. We could be witnessing a common metabolic response to modern American life, maybe magnified by specific genetic predispositions that just don't interact well with this environment.
So what does this all mean? The numbers are stark, GD is accelerating, and the burden is unequal. We need to look at why. The researchers are cautious, which is good science, but they do offer 4 main ideas to explain the variation.
Mm-hmm.
First, they point to differences in the risk factor burden. So, inherent genetic predispositions or higher rates of things like obesity or hypertension within certain groups.
Second, differences in health behaviors. So we're talking diet, activity levels, lifestyle things that are key for managing blood sugar.
Okay.
Third is variations in healthcare access.
Yeah.
Who gets early and good screening, who gets preventative counseling, who gets treated in time.
And fourth, they identified differences in social exposures. This is a term that really needs unpacking, I think.
It does.
It refers to all those social determinants of health, like your housing stability, your neighborhood, your access to quality food, all the structural barriers that impact your health long before you even see a doctor.
Right. And that constant stress absolutely affects your metabolic function.
Okay, but to maintain some balance here, we have to talk about the limitations of the study, the caveats.
We do. And it's vital because these concerning figures we're talking about, they might actually be an underestimate.
An underestimate?
Well, the first major caveat is COVID-19. GD screening was significantly interrupted during the peak of the pandemic.
Ah, right.
So if fewer people were getting screened correctly or on time, the actual number of cases is likely higher than what's being reported. The real alarm bells might not even be ringing loud enough yet.
That's a staggering thought, that this huge problem could be even bigger than the data shows.
Precisely. The researchers also mentioned potential misclassification of race or ethnicity, or just simple coding errors on birth certificates.
But they felt the data was pretty solid overall.
Yes, they note that other research has shown birth certificate data, while not perfect, is actually highly reliable for identifying GD diagnoses.
So what's the bottom line here?
The ultimate, non-negotiable takeaway, regardless of any limitations, is what the researchers conclude. They say these findings warrant urgent clinical and population interventions.
Urgent.
The burden of gestational diabetes is not static. It is worsening substantially and persistently across the entire country. Ignoring this is just not an option.
It's not. Okay, so let's do a quick recap of the key takeaway for you, our listener. Gestational diabetes is rising dramatically. It's up by about a third in just 8 years.
A huge jump.
And if you identify as Asian, American, Indian, or Native Hawaiian, the data suggests you are carrying a disproportionate risk. We saw the highest velocity of increase in the Chinese population, but really all Asian groups are significantly affected. So our call to action for you is clear, and it's simple. Use this data, use these facts to have a more informed, a more proactive conversation with your doctor about screening and risk assessment. If you're planning a pregnancy or you're in the early stages, please don't wait for the standard checkup schedule. Bring up these specific demographic risks with your provider right away.
It empowers you.
It absolutely empowers you to seek care that could be life-changing for both you and your child.
And here's a final thought, just something for you to mull over that builds on all this. Given that this study showed GD rates went up significantly in almost every single demographic, and in some, like the Chinese population, the rate of increase was just so profoundly high.
Right.
Should we be fundamentally rethinking what we consider a standard risk factor profile for GD in prenatal care? Not just in the U.S., but maybe globally.
What do you mean?
Well, perhaps what we're witnessing isn't just an increase in a disease. Perhaps we're seeing a fundamental shifting baseline for what normal metabolic health even looks like during pregnancy for a huge, diverse part of the population.
So our definition of low risk might be out of date.
It might be. It suggests that our current standards might need a rapid, immediate reset.
And that's a wrap on this episode of Med Decode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.